Hey, Dr. Coleman, what can you do about your pain if you come off your opioid pain medication?
It's a good question, and I think what you're talking about here is chronic pain. And, back in the 2000s when doctors were prescribing an awful lot of opioids for chronic pain, it seemed like the best treatment. But those of us in the addiction world knew that it really wasn't good for many people at all. Chronic pain is not well treated with long-term opioids because it just gets in the brain and it stops the brain producing its own endorphins, and it changes the way the brain perceives pain so that people actually on opioids start perceiving pain more than they did before they even got on the opioids. And we call that opioid-induced hyperalgesia, or extra pain, hyperalgesia, caused by the opioids themselves. It's bizarre and it doesn't make any sense, but that is what happens because the body's always in homeostasis. So when you put a drug like opioids into the brain adjusts to that, and it unfortunately then starts perceiving more pain. So truly, when we detox people off, and especially when we put them on naltrexone, they perceive their pain much less almost immediately, usually within a day or two. They come into the office, they say, wow, I thought I had this horrible back pain for the last 10 years, and it's not that bad. I can just take anti-inflammatories and stuff, and I actually feel better. So that's what mostly happens. The good news is there are other medicines that can help with pain that aren't opioids. There's a whole range of those, including gabapentin and anti-inflammatories, and there's also physical therapies and nerve blocks and all sorts of things that people can do that help with pain that actually work. Because truthfully, chronic opioids don't work well for chronic pain.